So welcome Maria and Hannah from Hong Kong Mental Health Center. And it's a pleasure to have you join our community partner showcase. So would you like to maybe just tell us a little bit about your role and the kind of services that Hong Kong provides to the community?
Sure, yeah. My name is Maria Low, and I'm the training coordinator at Hong Kong Mental Health Association. I have been working with Hong Kong since 2006, so almost, actually it's 15 years already, so it's a long time. We offer a continuum of services, mainly in 6 major areas. We have clinical services, and we also have a family support program for family member who have family members who are living with mental health issues. And we also have an integrated recovery program, and we focus on recovery approach for those programs. And we have the integrated community program. For that, we do a lot of health promotion and prevention workshops, because we strongly believe that prevention is always better than treatment. So we try to promote the concept of mental wellness, actually the holistic health within the community. And also we will, through the workshop, we also promote connection, because connection is very important, especially during the pandemic time. Isolation and loneliness is one of the very pressing mental health issues among our community. So also on top of that, we have Asian Clinic. That is a partnership program with bilingual psychiatrists and also doctors. So we offer, of course, counseling services as well. What else? We also recruit volunteer. Volunteer is a very important part at Hong Kong, as we all aware at non-profit organization that we have limited resources, limited manpower. So by mobilizing our community, recruiting volunteer, it helps to build the community as well. And of course, we have a very substantial youth program, youth and family program. We strongly believe that family is a very important part in the recovery concept. Maybe can you tell a little bit about the youth program that you are involved with?
Yeah, sure. So my name is Hannah, and I am the youth worker from the Youth and Family Program at Home Fook. So I'm just gonna give a brief introduction about our program. So basically, the Youth and Family Programs just aim to promoting resiliency for East Asian youth and their family members. So we offer different kind of programs for the youth and the family as well. So for the young people, we have a lot of programs. So, for example, we have Choices, which is a program to help them to discuss some common choices that they will have during their youth period. And also, we do have other one-time or drop-in program for the young people. And also for the family, we have the Parent Supporting Network, which is a support group for parents to discuss their parental issues or family connection, or how to discuss mental health with their children. And we do have a youth outreach worker in our team as well, which is a service that we can offer young people to connect with more volunteer programs or more youth programs that provided by other organizations. And we also have counseling services, and we offer both walk-in and short-term for the young people. And also we do have the service for the family member as well, in case those parents need to learn more about youth mental health. And we also offer in 3 different kind of languages, so in case they need a translation, and it will also work for them as well.
Wow, yes.
Mm-hmm. So that sounds like a lot of services. So how can people access your services? Like, do they need to have OHIP, or do they need to like be referred from somebody, or can they just call you up directly, or what?
Well, they can self-referral, like they can call us. We have intake worker, and so we will answer their question, and we will also do the thorough assessment to make sure that our service like meet their need. So that kind of thing. And also, like say if individual is suitable for our case management services, but if there is a waiting list, but they still can join our other program. They can join our integrated recovery program, and they can also participate in our workshop, community workshop, or any kind of training workshop. So that at any entry point they can do that. And also, of course, they can refer by their family members or doctors or the health practitioner. Yeah. So we accept any kind of referral. Yeah.
So I know the pandemic has a huge impact on people's mental health, right? And
Yeah.
as mental health service agencies, can you tell us a little bit about like what kind of changing needs or issues that you've seen arisen in our community since the pandemic in terms of mental health impact?
Okay, maybe I can talk a little bit about in the general, and then Hannah can talk about maybe especially among the youth group. So I would say that it's about 20% increase in our service demand. And so as we all aware, when we are talking about nonprofit organization, almost all the resources and manpower are maximized. So in order to meet the need, we have to be creative. We have to be innovative. So luckily, most of our we have technological support, technology support, so we can use the virtual, the phone, the smartphone to connect with clients and also to conduct workshops. In fact, there is an idiom. It is saying that crisis, when there is a crisis, there is always opportunity, which is so true. And I think during this pandemic time, we are able to connect with like even more people. And also not only we are able to connect more people, but also we can have a more in-depth kind of interaction. Because I think through the virtual connection, people are feeling more close, and they are also willing to talk more. And it's much easier for people to get connected, because before, if they have to travel, for some people, it plays a challenge. And also because of the pandemic, most people are staying at home. And also that free a lot of time as well. So after during this pandemic time, I would say that the service demand increased, but we're able to meet all those demands. How about among the youth group, Hannah?
For us, yeah, like it's definitely a huge change for both youth and their family. So because this pandemic, they have to spend more time together, and I will say that's a good thing and bad thing at the same time. So they will get to know each other like a little bit more, but also because they're spending so much time together, definitely there's a challenge for their family relationship, and also for the young kids. We're hearing from parents that they feel a little bit upset, or they feel a little bit confused, and some of them mentioned that because they're Asian, so they receive some racism issue from school or on the street. So we were trying to in the past year we did a lot of things for that, because so for example, we moved almost all our service into an online Zoom meeting, which works pretty well, I think. And also we increased the consulting service by we settled down a walking service for them, so they can just call and or arrange a video meeting with our clinicians, and we try to decrease the waiting time in 1 week. So that every young people call the service number, they can get the service as soon as possible. And also for the racism issue, we have discussion, and we also invite both young people and parents to discuss that question. And for the because we receive a lot of family relationship questions, and so we invite clinician, doctor, and also social worker, and also clinician, and we also include family members and young people to share their thoughts and their experience on their how to improve their family relationship. And during the summertime, we know it's kind of hard for young people to stay at home, such good weather outside. So for the young people, we actually prepare several programs for them, such as art program or online yoga, so they can meet other new kids online. Yeah, and then like do some summer camp stuff at home safely. And also for the back school season, we prepare some short workshop for family members and youth to discuss how can they go back to school safely, and also how can they prepare such a big change under this pandemic situation.
Wow. Yes, that's great.
Yeah, so I know the youth are very techno savvy, right? But did you find that like our community members in general, maybe like the older population or the people who don't have as much access, does the online access to services or programming, create any challenges or any things you need to do to address that?
Yes, definitely. Thank you so much, Ellen, for raising that question. As you said, some of our uh, service user, they have that challenge, and some of them may not have the cell phone or smartphone. Of course, they won't have the internet, access to the internet. So we partner with our business donor, and we receive donation from different donor for the smartphones and also SIM card. So we are also able to. We have committed volunteer. They teach the service user how to use that, how to use the smartphone, how to go online, and how to use the SIM card. So most of the service user, they are able to access to our workshop and also to our services. Yeah, so that's another beauty of in crisis, that people working together to collaborate together and also to make it happen. Yeah.
Do you find any issues with concerns about privacy or confidentiality online when people are doing group work? Or
Definitely, some of our service user, they do have that concerns, um, so they don't feel comfortable like to reveal like their face. So sometimes it's call in, so we can also use the dial in services as well. So there is always a way that we will try to accommodate. And although we are mostly our services are provided through virtual, we also still have our colleague providing face-to-face services if needed. But of course, we do all the safety measure before we do that as well.
So the pandemic has gone on a lot longer than I think everybody has expected, right? And now we're into the second wave. What do you see are some of the challenges that we need to, work together to address, as the pandemic continuing and, we are facing the second wave?
Well, I would say that the pandemic fatigue is getting on most people, including myself. People are getting relaxed and getting burnout. We got burnout. So I think that to respond to that, we really have to do more promotion on the tips and self-care. I really find self-care is very important. And maybe Hannah, you can talk later on for your group. Like a lot of our group member, they share that loneliness and isolation as like especially among the seniors, like they really get hit hard because of the lacking of the digital how you call it, like a knowledge, and also the language barrier. And so they are really feeling very isolated and lonely. So that we can see a lot within our community. So we have to do a lot of workshop, and also we build different groups to address that. For example, we have one of the Mandarin seniors group that we share about how you call the indoor um, gardening. So like growing different things that you can also use on your daily cuisine. And also that also is help you to relieve some of the tension or stress. And by also the interaction, people feel more connected with each other. And also the forum allow people to about the frustration, the loneliness, and also the stress. So they can be support for each other. So building the resiliency through all these like group session, I think it is one of the very effective way to do that. How about, maybe Hannah, you can talk
Hannah,
about
yeah.
among your group.
Yeah, I definitely agree with Maria that some people might feel a little bit numb about this pandemic situation, and they probably think, oh, that's nothing. And but we all know it's not the situation. Like it is, we still need
Yes.
to take like we still need to be really careful. So for next year, actually youth team, we already revised our plan based on the second wave because originally we thought this thing will ended this at the end of this year, and we thought we can go back to service in person, and obviously it's not like that. So we already set up that probably for our participant safety, we just gonna at least make the first 6 months still online service. We're still gonna see each other in Zoom, and we do notice that there's a huge demand from young people that they want more program, they want to see new people, and they feel a lot of challenge about online school as well. So for next year, our plan is we're trying to engage more youth in the decision making process because for the 2020, most of the program we are planning about the program by our youth worker. But since we want to invite more young people to participate in and also engage them and also build their leadership. So probably in the early January, where we'll start to connect with them and ask them like, what do you want? And maybe if you want to, you can plan some program by yourself, because actually some of the parents connect with us and said, my kids stay in the home, and because the online class they don't have a lot of new friends because they feel uncomfortable to meet new friends just through the screen, but they actually want more interaction between their like same age friend, not just their friend, not just their family or relative. So one of our new plans is having more workshops just suitable for young people. And also, I agree with Maria that a lot of our clients also feel really lonely. So I think although the Zoom session won't completely replace the in-person
Yes.
reaction, but I think we'll still keep doing. And I also agree, Alan said in the before that some people might have challenge or they feel uncomfortable to do video phone call. So we will do our best. We're probably gonna call them or drop a little gift in front of their door and just like create this social distance. We're not going to like actually meet you, but give you some little gift. This is actually what one of our colleagues did during the pandemic time. So she dropped a little snack gift in front of the young people's house, and when we do the Zoom meeting, we can eat the snack together.
Wow.
So I think that's a really good strategy, and we'll keep doing for next year.
Yeah, sounds like you folks are doing wonderful work, and it's certainly very badly needed in the communities. And we really look forward to continue to work with you to do more joint initiatives and support our communities. So is there any tips or advice you would want to give our audience, like some parting tips for the new year in terms of improving mental health?
I would say that never give up on self-care. Self-care is really, really important. We always have to spare some time to take care of ourselves, because if we are not taking good care of ourselves, nothing can happen. Like I always believe it has to start with ourselves. That so you have to allow yourself to be not okay. It's still okay. And also, I think to continue connecting with others from whatever means, it is also important, because the isolation and loneliness is really get on our mental wellness.
Hannah, thank you, Maria.
For me, I know it will be really hard for us for this Christmas or this New Year, because we might just need to spend this probably alone or just with your family. You can't see your relatives, you can't see your friends, but it's okay. If you can still use the technology to e-meeting your friends, like send them an e-card or use a Zoom meeting to have a visual gathering. And also, like since I work in the youth team, so I will encourage parents to talk a little bit more with your kids, because as an Asian, I know that it might be hard for them to talk about mental health in the family setting, but it's totally fine, because if you're a parent, talk mental health with your kids. That might seems like makes you seems pretty cool. And if you're young people, you can be open to your parents, because I know like they love you so much. So if you have any difficulties, just talk with them. Don't make the things too serious, but just maybe say like, I feel a little bit lonely, or can we talk about this? And maybe you can just talk about this in the thing, like a meal setting, like having lunch, breakfast, or dinner. It doesn't really matter. So yeah, just enjoy your Christmas holiday and maybe talk about mental health if you want.
Yeah, so I think mental health is such an important part of our health, and we need to overcome the stigma and really make it a point of connection, right? So it's great having you sharing your thoughts on our community partner showcase. So thank you very much, and wish you a very happy 2021.
Same here. Thank you so much. Bye bye.
Thank you.
Thank you
Bye-bye.
so much. You too.